The classification of hematopoietic cells encompasses 6 distinct classes, each playing a crucial role in the development of various blood components. This systematic categorization not only aids in the understanding of blood physiology, but also enhances comprehension of associated blood disorders. The maturation of erythrocytes is characterized by significant alterations in cell structure, including variations in nucleus size and hemoglobin content. Such transformations are critical for ensuring the optimal functionality of red blood cells, which are indispensable in oxygen transport. Normal blood counts exhibit notable differences between men and women, an aspect that profoundly influences the interpretation of hematological results. Therefore, employing accurate counting methodologies becomes essential for the effective diagnosis of blood-related conditions. The average volume of red blood cells holds substantial importance in the diagnosis of various health conditions. Specific reference values serve as indicators to determine whether an individual is healthy or facing potential medical issues. Newborns demonstrate distinct hematological characteristics compared to adults, notably exhibiting elevated respiratory levels. This phenomenon reflects their unique physiological demands during the crucial stages of early development. Erythrocytosis and anemia represent 2 opposing conditions that significantly affect red blood cell counts. A comprehensive understanding of these disorders is essential for diagnosing and addressing underlying health issues effectively. Anemia can be classified into congenital and acquired types, depending on the causative factors involved. This classification not only aids in discerning the underlying issues, but also assists clinicians in tailoring appropriate interventions. The severity of anemia may be categorized into 3 distinct degrees: mild, moderate, and severe. Each degree is defined by specific thresholds of hemoglobin and erythrocyte counts, which provide crucial insights into the intensity of the condition. Anemia can result from blood loss, which is further classified into acute and chronic forms. These classifications critically impact the body's iron levels over time, demonstrating the need for targeted diagnostic strategies. Reticulocytosis serves as an important indicator of a compensatory response to acute blood loss, characterized by an increase in the formation of reticulocytes in response to elevated erythropoietin levels during episodes of hypoxia. Anisocytosis, defined as the variation in red blood cell sizes, may present as macrocytosis, a characteristic feature associated with acute post-hemorrhagic anemia. This variability can provide critical diagnostic information. Polychromatophilia is observed as varying degrees of staining in red blood cells. This condition reflects the rapid influx of erythrocytes that limits sufficient hemoglobin saturation, warranting further examination. Copper and zinc deficiencies significantly contribute to the development of anemia, as these trace elements are vital for the enzymatic functions involved in red blood cell formation. Their roles in erythropoiesis are crucial, yet often overlooked in clinical settings. Vitamin deficiencies, particularly regarding B12 and folate, are critical contributors to anemia. These vitamins are essential for the synthesis and production of red blood cells, emphasizing their importance for overall health. Laboratory tests are instrumental in assessing iron metabolism and reserves within the body, key factors in diagnosing iron deficiency anemia. Indicators such as serum iron levels and total iron binding capacity play essential roles in this diagnostic process. Certain dietary acids, such as oxalates and phytic acid, can inhibit the absorption of iron from food sources. This diminished absorption can lead to deficiencies over time, underscoring the importance of dietary choices. Chronic blood loss arising from conditions such as uterine bleeding or gastrointestinal disorders can lead to the development of iron deficiency anemia. Prolonged blood loss ultimately results in the depletion of iron stores within the body. Iron deficiency manifests through a variety of symptoms, including hair loss and muscle weakness. These symptoms can be particularly pronounced during pregnancy, a period marked by increased iron demands. Microcytosis is closely linked to energy deficiency, which adversely affects red blood cell formation and division, resulting in the production of smaller erythrocytes. This relationship emphasizes the necessity of adequate energy for normal hematopoiesis. Vitamin B12 deficiency anemia significantly impairs DNA synthesis, a process crucial for erythropoiesis, leading to varied systemic consequences. Understanding its role in cell formation is vital for accurate diagnosis and treatment of related conditions. The megaloblastic type of hematopoiesis is characterized by a marked reduction in mature erythrocytes, resulting in a shortened lifespan of red blood cells. This underscores the importance of adequate nutritional intake for sustaining optimal blood health. Hematopoiesis is a fundamental process for understanding blood cell formation, especially noting its transition from the liver to the bone marrow during developmental stages. This progression influences the diagnostic approach in newborn populations. Megaloblasts, larger than typical erythrocytes, can indicate specific types of anemia. Recognizing these abnormal cells is essential for differentiating between various hematological conditions and guiding effective treatment. Folic acid deficiency exhibits manifestations akin to those seen in vitamin B12 deficiency, impacting not only blood health, but also the developmental processes of the nervous system. This highlights the critical importance of ensuring adequate prenatal nutrition.